I'm Dr. Jeff Summers. I'm the medical director of the Department of Psychiatry here at Enrico Dr. Parham Hospital. But there's quite a few different types of anxiety as well as anxiety disorders. It's interesting though when I meet with a patient who's struggling with anxiety, frequently their anxiety symptoms don't necessarily fall into one clear-cut category. For example, there's generalized anxiety disorder, which is really the hallmark of generalized anxiety disorder is worrying. Another term actually is generalized worry disorder. But there's obsessive compulsive disorder, people that may engage in checking behaviors, a lot of obsessive ruminations. Post-traumatic stress disorder is also an anxiety disorder. Panic disorder is an anxiety disorder. And then there's different types, subtypes of anxiety, like separation anxiety, social anxiety, performance anxiety. And it's interesting when I'm meeting with a patient who's struggling with anxiety, they may have snippets of each of these different diagnostic types. For example, a person that may be a worrier that fits criteria for generalized anxiety disorder may occasionally have a panic attack. They therefore are not necessarily fitting criteria for full-blown panic disorder, but they may have a snippet, a piece of that disorder. And a lot of people with generalized anxiety disorder also struggle with social anxiety. So rarely is it clean-cut, one particular diagnosis. But anxiety disorders are very common and can really have a significant impact on a person's functioning and quality of life. Many of the symptoms of anxiety are common sensations to all of us. Heart pounding, sweating, feeling tremulous, worrying about things. But it's really a matter of degree, the intensity of those sensations, as well as the chronicity of them. How long do they last? And as a result of them being intense and lasting long, how much they impact in a negative way a person's functioning and the quality of their life. We're discovering more and more that there can be brain chemical components to anxiety. A person may be more genetically predisposed for anxiety. For example, if I have a patient that is a worrier who has generalized anxiety disorder, one of the first questions that I ask them is, who taught you that, or where did you learn that? Does either of your parents, would you classify either one of them as a worrier? Frequently the answer to that question is yes, one of the parents is a worrier. So there very well can be genetic predisposition that it's useful to be aware of family history when I'm treating a patient.